So tell me about Colorado Surgical Institute. What type of courses do you offer? What's the curriculum?
Yeah, so we construct this in a way. Initially, it started off with, okay, let's just do all on fours, or all on X's as we call them, because sometimes we'll place 6 or 7 or 8 implants. But what we found out was there's a lot of docs who need to do some of the easier procedures first. And I use the word easier in quotation marks because nothing on the surgical end is easier,
okay,
right? So we set it up in a way where it's a virtual component of the curriculum where you get to do this at home. Do it at home with your family. Don't take time off work. Don't lose the production. Don't lose the revenue. Let's utilize the internet. Let's utilize non-antiquated techniques to get you the education you need. And the great part about it, we can still get you CE for your virtual PACE certified CE for your virtual curriculum you do at home.
Is this pre-recorded or live?
So there's going to be a pre-recorded section that you do at home plus a textbook that you get. Then we do a live Zoom call where we do all the case reviews for you. So any patient you're going to see and treat, we're going to review that ahead of time on a Zoom call or whatever platform we're going to use at that time. Then you're going to come in and day one, we're going to talk about the financing, how to finance cases. It means nothing if you have patients come in and they can't afford anything. So we're going to teach you how to finance the cases. Then we're going to teach you how to market the cases. Because again, you can be proficient and finance the case, but if you can't get someone to come into the practice and actually say yes, you're not going to do the procedure. Then we're going to show you a video of me or Dr. Brisky's surgery, and we're going to fast forward through it so you don't have to watch an hour-and-a-half procedure, but we'll go through and talk about all the pertinent things that you need to do on your procedure. And then guess what? It's time to suit up. You're going to have a sedated patient, or you're going to have a patient who is already anesthetized, and you're going to get in there and you're going to start placing implants, or you're going to start extracting teeth. So we have a novice type of situation set up where it's extractions, bone grafting, maybe some simple implants. Then we have a more intermediate one where it's, okay, well, it's going to be more complex extractions, more complex bone grafting, maybe some immediate implants, maybe some big defects with infections that you need to graft around, some block grafting, some lateral grafting, some sinus grafting, some lateral sinus augmentation, like all the cool stuff that you're going to be doing on a regular basis if you make the investment. And then we have the beginner implant package where we do like a single arch of implants. Now I say it's beginner, but it's still pretty darn difficult.
Okay.
And then we have, I think Dr. Brisky calls it the double black diamond X terrain, because it's Colorado course, where it's a double arch, block grafting, lateral grafting, the hardest case that we can potentially find you. You're going to come in and do it under supervision, so you're going to feel confident going home in your own practice and treating complex patients.
Digital workflow.
Absolutely. And the best part about this is it's not analog. We have all the scanners in-house, we have the 3D printers in-house, we have the milling units in-house. You're going to sit there, you're going to scan your own case, you're going to go design it with the designer, you're going to print your own case, and then the very next day you're going to deliver your own case and adjust the occlusion and go through the whole process in one day, compared to like having to do it in your own office and not really know what to do and not know what's normal and what's abnormal. You're going to do that whole workflow in just one weekend in our practice.
I think one of the nice things, if you guys are trainers, coaches, is that you're super successful, that you have a great practice. I know that you told me the numbers. It's more than 95% of all dentists in the world, or at least in the US. Do you think there's an advantage? I mean, if you seek a coach, you should find someone that also has proved it in the numbers.
Absolutely. I mean, me and Dr. Brisky, we eat our own cooking. So anything we're going to teach you, we're doing real time all the time. And as we evolve into as we evolve the process, as we change the digital workflow, well, guess what we're doing? We're sending out all this information to all our students. So we're keeping you updated in real time about what's changing in the industry, because the technological curve is so parabolic that we have to read on this first thing in the morning, last thing at night, so we don't fall behind. And we take all that information, we do all the research and all the literature review, and we give it all to you.